If you're on a journey to improve your health, you might want to consider getting a total body composition scan. Saltzer Health Radiology Technician Brian Van Mason explains how this scan can help pinpoint problems in the body before they occur. Brian, tell me about the total body composition scan. What is that?
So a total body composition is just that. It basically scans the entire body. The results that we obtain from that include stuff like your metabolic rate, your fat, the good and bad fat, if you will, on the body, your muscle mass, for example, stuff like this. That's kind of what a total body scan does.
Okay, and what's the benefit of having this information?
So the benefit of that is for folks that are interested in their overall health, people looking to lose weight, athletes, for example, looking to improve performance with lean muscle, so on and so forth. That's the benefit. It gives you a baseline to look at your numbers, look at the results, and then kind of go from there.
Okay, and how long does a scan like this take?
So a scan like this will typically take anywhere from 5 to 7 minutes, depending on the size of the patient. The larger the patient, obviously, if you're 5 foot, it takes a little bit shorter time, literally. If you're longer, the scan's a little bit longer, that's all.
Okay, and once you have the information, like you had mentioned, you'll take that for your personal benefit, however you're trying to improve whatever your goal is, which means that you probably want to have a second scan done to see if there was any improvement. At what point should someone have that scan done?
So typically it depends on the individual and what they're after. So if you're after weight loss, for example, 3 months would probably be a good opportunity to return to see where you're at. If you're looking for more for athletic performance, 3 months works as well, but 3 to 6 months on average for both is a good time frame. And of course, that's just an average time frame. You can come back every 6 months for a number of years. If you want to, it really depends. And it's just not limited to athletes and people looking to lose weight. The older generation, for example, if they're looking to build muscle mass for their health or whatever, they can come in annually and probably have that done, which would be a great benefit for them.
Okay, so let's talk about getting the scan done. What do you wear to a scan like this?
So we recommend just kind of loose fitting clothes, no metal or as least metal as you can, no blue jeans preferably, sweats would work a lot better. Just something very comfortable. You're just going to lie on this nice soft table, lie down for 5 to 7 minutes and take a little nap, and that's basically all you have to do.
And how soon do you get those results?
The results are instantaneous. So what I do is I'll print out the results here in the room. I can actually go over some of those results with you, but I'll be honest with you, the person that would be most interested in these results would be like a nutritionist, a dietitian. They can look at that and go, okay, well, this is where we're going to start. In 3 months, let's see where we're at. And that way we can change diet, we can change exercise, change routines or whatever. But the results are here. They're printed off the same right after the scan. We can review those very basically with the patient, and they are theirs to keep.
And Brian, where can people go to learn more?
saltzerhealth.com/imaging.